This is part 2 of mental health disorders in children and adolescents. So let's talk about some interventions for controlling aggressive behavior. They include pharmacological agents, cognitive behavioral therapy, behavior modification, assess parents' knowledge of the disorder, provide information as needed, assess the impact of patients' behavior on the family life, discuss settings that are realistic with behavioral goals, and refer parents to local self-help groups. Some techniques for managing disruptive behaviors include redirecting the child's attention to an activity, using humor as a diversion, appeal to the child's developing self-control, give early help to a child who is easily frustrated, clarify situation and motivation for behavior, change activity to decrease stimulation or frustration, remove the child from the situation, and set limits. Anxiety disorders. Anxiety is part of normal development. It's a problem when an individual fails to move beyond the fears associated with certain developmental stages. And development is in response to physical or psychological stressors and interferes with normal functioning. There are 2 anxiety disorders of children and adolescents: separation anxiety disorder and post-traumatic stress disorder. So symptoms of separation anxiety disorder include excessively anxious when separated from parents and or their home, excessive anxiety when anticipating the separation, fear of being lost or kidnapped, refusal to sleep without a parental figure near, refusal to attend school without the parent, and physical symptoms as a response to the anxiety. Symptoms of post-traumatic stress disorder include nightmares, irritability, difficulty concentrating, and hypervigilance. Your assessment should include exposure to extreme traumatic event and internalized or externalized anxiety. Nursing diagnoses include anxiety, which is probably severe, fear, ineffective coping, and delayed growth and development. Interventions for anxiety in children include protecting them from panic levels of anxiety, provide emotional support to help them progress developmentally, increase their self-esteem and feelings of competence, help them accept and work through traumatic events, cognitive therapy that will focus on underlying fears and concerns, and behavior modification reinforcing self-control behaviors. Mood disorders. Symptoms include sadness, hopelessness, anhedonia, social withdrawal, and thoughts of suicide. Complications can be school failure, drug and alcohol abuse, sexual promiscuity, running away, illegal and antisocial behavior, and suicide. Factors associated with depression include physical and sexual abuse, neglect, homelessness, parental marital problems, parents' death, divorce, or separation, learning disabilities, chronic illness, and conflict with or rejection by the parents or their peers. Interventions include family therapy, parents' activity involved in treatments, multiple family therapies with families as co-therapists. Treatment interventions also include group therapy, can be play for younger children, play and talk for grade school children, talking about peer relationships and special problems for adolescents. And then there's milieu therapy, which is basis for structuring inpatient, residential, and day treatment programs. Their therapeutic environments provide physical and psychological security, promotion of growth, mastery of developmental tasks, and treatment for psychiatric disorders. There's also behavioral therapy. It's based on the principle that behavior that is rewarded is more likely to be repeated. Specific treatments include operant conditioning, point and level systems. And then modifying disruptive behavior, increasing the structure of an activity, and using all available resources. So, removal and restraint. There are 4 different things to talk about there. First is seclusion, and use of seclusion is controversial. Reflects the staff's lack of confidence in their ability to handle the behavior It's perceived as punishment by the child or adolescent. An experience of being overpowered by adults is terrifying for abused children, so it's not good in that situation, or any situation at all. The second is quiet room, an unlocked room used for removing a child from the situation so they can regain self-control with staff support. The feelings room, which is carpeted and supplied with soft objects that can be punched or thrown, and the freedom room, which contains a large ball for throwing or kicking. And these are all alternative approaches. Then there's time out, so intervening disruptive or inappropriate behavior by removing the child from the activity. The child regains self-control and reviews the episode with the staff. There's also therapeutic holding. It's not disciplinary restraint. It's used to control destructive behaviors. Prompt, firm, non-retaliatory protective restraint. In other words, hug and hold. It's used to reduce the child's distress, and it produces relaxation and returns self-control and trust in staff. So cognitive and behavioral therapy, the goal for this is to remove maladaptive responses and replace with new cognitive and behavioral competencies. There's also play therapy, and the guiding principles are accept child as he is and follow the child's lead. Establish warm, friendly relationship to help the child express their feelings. Recognize feelings and reflect them back so the child can gain insight into behavior. Accept the child's ability to solve personal problems. Set limits to provide reality and security. Use of dramatic techniques to act out emotional problems and try out new behaviors. And use of hand puppets, puppet shows, or dramas to enable the children to act out problems and solutions. And then finally, there's pharmacology. Medications that target specific symptoms have the potential to increase the ability to cope, increase quality of life, and enhance potential for growth. So these are common medications when needed. You can use these next slides for a quick reference, and I'm not going to go through them, but it lists each disorder and the different types of medications that are used for those disorders. And then finally, as the nurse, you are the patient advocate. You must establish a therapeutic alliance. This is based on acceptance and trust, which will convey security to the patient. And when the patient feels secure, they will be more acceptance of interventions. All right, so that's the end of part 2 of this lecture.